Why is medical malpractice so common in New Mexico? My name is Dylan Crabb. This is Bobcat Radio. Just wanted to share this article with you here from Searchlight, New Mexico, December 5th, 2024. New Mexico's malpractice gold rush. The state is a rich landscape for attorneys who cash in big on medical liability lawsuits. The soaring cost of insurance against such claims is pushing some hospitals to the brink. In New Mexico's sprawling northeast corner, residents only have one healthcare option. From everything from medical emergencies to annual physical exams, Union County General Hospital, UCGH, a first service facility in Clayton, the Tally County seat. In just over a month, it might be forced to close its doors for good. So this is about articles about the struggles of the one specific hospital in northeast New Mexico. UCGH faces many of the same pressures that are straining rural hospitals throughout New Mexico and across the country. Declining populations and low reimbursement rates for Medicaid and Medicare patients, who are overrepresented in small towns, have made it difficult to cover costs. A nationwide shortage of doctors has hit rural hospitals especially hard, as more and more physicians opt to move to urban centers. But New Mexico has a unique problem, and that has pushed many hospitals in far-flung areas into crisis mode. The state has become so lucrative for medical malpractice lawsuits that most insurers have fled. Why has the state become lucrative for medical malpractice lawsuits? Why is this so common here? The few that remain now charge such exorbitant rates that small hospitals are desperately struggling to pay the premiums if they can even find an insurer to cover them. And this reporter talked with Tammy Chavez, Chief Executive Officer of UCGH in Clayton. Apparently, she looks for insurers from all over the world. After scouring the globe and being rejected by more than 40 insurers, Chavez was able to find two companies willing to cover the hospital at the 11th hour. The price tag for the cheaper of two available policies, $850,000 a year, which is nearly 500% higher than the $142,565 premium the hospital had paid previously. I don't know why that's legal. $500% higher. On top of that, she would have to put up a $100,000 certificate of deposit and close down the hospital's bariatric program. I believe that's a program relating to obesity issues, which the company would not insure. She signed the papers, keeping the hospital's lights on for another year. Now, once again, Chavez needs to find another plan when the hospital's current coverage expires at the end of this year. If insurers hike up the price yet again, I don't see how that should be legal. The cost of coverage will likely close the hospital. The county's only healthcare clinic and a school-based health center, all of which are staffed by UCGH. There is not another hospital in New Mexico close to me for 84 miles, Chavez says, referring to the nearest medical center, which is in Raton. For patients needing specialty care for certain conditions, the closest facility is in Amarillo, Texas, a 2-hour drive away. And they have a map here. Clayton, northeast New Mexico. Raton, like an hour away, looks like. Amarillo, 2 hours away in Texas. Clayton's real close to Oklahoma and Texas. So that's the problem, right? So this year, the New Mexico legislature passed HB99. It still has to be signed by the governor. I believe she has 20 days from the closing of the legislative session to sign it. Medical malpractice changes. Here's a statement from the governor, Governor Grisham. Passed legislation that would rein in skyrocketing medical malpractice claims, protect patients' ability to seek compensation for harm, and help expand the number of doctors practicing in New Mexico. Medical Malpractice Reform Bill, HB99, passed the House by a 66-3 vote, overwhelming majority. With this bill, we're not choosing between patients and providers, we're choosing both, the governor said. It establishes tiered caps on punitive damages that scale based on the size of the medical practice or facility, approximately $1 million for independent providers and clinics, $6 million for locally owned hospitals, and $15 million for larger hospital systems. The caps are just annually for inflation. To me, that seems like it's offering an incentive to sue hospitals, but what do I know? I just want to bring your attention to this. What do you think about this bill? It's HB99, medical malpractice changes. Here's what the bill looks like. House Bill 99. So yeah, tell me what you think.